listening to the Inspire Excellence podcast, recorded at the BVA headquarters with your hosts, Bill Whitacre and Tommy Ahlquist. Bill is the former CEO of the JR Simplot company and is now a full-time adventure seeker and philanthropist. Tommy is the CEO of BVA Development, co-founder of Crush the Curve Idaho, and most importantly, a full-time grandfather. Each episode focuses on sharing the stories of individuals who are changing the world.
Welcome to this week's edition of Inspire Excellence podcast, looking to shed light on important issues for our community. We're just thrilled today that Dr. Jim Souza, the Chief Medical Officer at St. Luke's Hospital, has been able to carve out some time to be with us, and we're excited to get your words out to the community, Jim. I want to start just by telling you thank you. I worked with you as a doctor for years. I can tell you, Jim was the ICU doctor when I was an ER doctor. And there is no better respected clinician in the state of Idaho, taking care of patients, just an amazing human being, amazing family, amazing Idaho leader. And now we have you to look up to, Jim. I follow, I listen every time you do an interview. You're at the hospital, you're in the middle of this. Thank you for being here today with us. And we're going to get right into it. I think Bill's going to welcome you, and then we'll ask you the first question.
Okay.
Well, for me, it's actually more than a welcome. This Dr. Jim Souza is, and for me, he's Jim, and he, from being associated with St. Luke's Hospital in my role on the board, my respect for him, and it's long before COVID, just his leadership ability at the hospital as chief medical officer has been huge. Listen, COVID comes up, and we have this unbelievable circumstance where it was beyond what anybody's experienced, and to have Jim step in a leadership role, and initially it was hospital based. It was I can remember me coming home quickly from New Zealand, thinking I got to get home. It's the middle of March. There's issues, with COVID. And the first thing was connecting to the hospital and seeing what had to happen, what needed to happen, what were the voids. And Jim's leadership was unbelievable. But now he's turned into being a leader for the state, with the governor, with I think Director Jepson. I think he possibly is one of the most respected voices on COVID for the state of Idaho at this time. I could say he is, but I don't want to offend somebody that I don't know. So I'm going to say possibly. I think he is, actually. So the point is, Jim, hey, part of what really troubles me is, and I haven't done this, we haven't done this as board members lately, but walking through the hospital, how do you keep the energy up in the hospitals right now? I mean, because it's always been this kind of vibrant, high energy, the hallways full of hustle and bustle, but something tells me it's almost, it could really get to you in a hurry if somebody wasn't there trying to keep positive energy in the system.
Yeah, that's a great question. And thank you both for the overly generous introduction. Really, yeah. I'm flattered. In the hospitals now, It feels like we're transitioning maybe from fatigue to trauma, and what I mean by that is that it's a repetitive sort of insult now for the frontline healthcare worker, and we all need to do our part to help with that. They're leaders like me. We're cheering for them all the time. We're loudmouths. We talk about their great work. But as Tommy knows, people who get into healthcare, they at inception they get into it because they want to help people. It's like it's truly like mission work for a lot of us. And so, sadly, what's happened with some of the dialogue around COVID, whether the dialogue is that it's a hoax, like not real, or that it's not a big deal, it's just a flu, the learned experience, the lived experience by the people on the front line is so different from that, right? And they're seeing all of the suffering and sadly some dying that, I mean, they also know, and this is another part of the healthcare provider psyche, is you're there to fight disease, and any disease you can prevent, like you want to go upstream and prevent that. You want to stop it from happening. So these are healthcare workers, right, that are working in really busy hospitals, packed with people who are infected with this disease. And the transmission that's occurring amongst our healthcare workers, it's happening out in the community. It's not happening when we do contact tracing in our facilities. So it's kind of a 1-2 punch for the healthcare worker. They're seeing suffering and dying that they're going to check, largely needless. And then they're hearing out in the community or on social media a public conversation that I don't think this is the majority opinion. It's just a loud minority opinion that's saying, yeah, that's a hoax or it's not important. And that's demoralizing. That kind of contributes to that, fatigue becoming trauma. I'd love it if we could engage more of the public that are in that silent majority to speak up, write a letter to your favorite healthcare worker, send a letter to the editor and call out the good work that you see. It would make a big difference.
Hey, Jim, can I follow up on that a little bit? I've got really good friends. So one of my best friends is Jim Torres, one of your doctors in Sun Valley. I love that guy. And when it first came through, he called me. He's one of the smartest guys I know. And he said, this is a bad deal, right? And I still have a lot of my old partners and friends that are in the ER, and I talk to them all the time. I think that your line there, it's gone from fatigue to trauma. You always have a way with words, and that just resonates. So that just hit home with me with what they're feeling right now. I got to tell you, Jim, for months, I had a lot of patience because I thought, everyone's an expert on the internet and everyone believes what they have. And by the way, Trump's leadership on this from the national level has been pathetic, and it fueled the flames of conspiracy theorists and right-wing people everywhere, right? But I've been patient with all that because I thought, you know what, benefit of the doubt, right now our hospitals aren't overwhelmed. But I always thought in my heart, as a provider, as a physician, as a father, as a community member, that once we got here, where the edge of the cliff is right there, Jim, that they'd stop it, that they would just stop it, that they would say, we're not lying to you. And there is a cliff. I don't think people understand what it means for St. Luke's to go on divert to anyone that has anything. Can you please, because I don't believe it's changing now. I think Trump, even in defeat, is doubling down on every stupid thing he's ever said. I think he's further empowering this base. And I agree that they're a minority, but they're loud. And I do believe they affect people. I was with someone today, and I just thought to myself, I was shaking my head thinking, I've lost my patience with you, but we can't do that. How can you message even stronger today with us that we need to take this seriously for our community, for our families? Because we're not through this yet, Jim, are we? The worst is yet to come.
Wow, that's a great question. I think the data that I've seen in terms of, how many people, because I do think, Tommy, there's probably people whose, minds will just be made up. We cannot change their mind. It's almost like, it's so much bias, confirmation bias about anything coming their way is going to be interpreted through a certain filter to confirm their belief system. But the data I've seen is that probably 20% of the folks who don't believe in masking and distancing and who might believe that it's really not that important, that their minds can be changed. So I'm just not going to give up hope, and I'm gonna keep here's the message I've conveyed when I've been in front of those audiences. And I had a chance to be on Kevin Miller's talk radio show a little while back. And, I took some flamethrower comments, and, I just came back with this attitude of, I'm not going to preach. I'm going to try to teach, which can be challenging. I think a lot of people want to learn, but not everybody wants to be taught, if you know what I'm driving at there. And I've been really careful to try to not come across as, a guy in a white coat doing this, waving my finger at people. Because I'll tell you, I learned in my own clinical practice a long time ago, probably 20 years ago. I'm a pulmonologist, right, by training, dealt with a lot of tobacco addiction. I learned pretty early that I can never get anyone to quit smoking by going, you need to quit smoking. The way I get them to quit smoking is to ask them, what do you like about cigarettes? What do you not like? What are you spending on it? What are your goals? And once you kind of get into that space with another human being, you can actually find common ground, and quitting smoking can become their idea. So my thinking with the anti-mask crowd is, my hope is that we can still find common ground. Like, what do you want? I don't want to take away anyone's freedom. I just want I've been saying repeatedly, I'm more interested in collaboration or cooperation than compliance. Like, let's move away from that mandate and mask. I want it to be your idea. So what's important to you is the freedom to to be able to access good quality healthcare. Is that important to you? Is that important to your spouse? Is that important to your children? Because let me tell you, we're letting that erode right now. Is the freedom to not have, a panel of doctors decide whether or not you're entitled to certain aspects of critical care? Is the freedom to avoid that important to you? I think it is. And well, let me tell you then, I got a way that we can retain that freedom for you. I want to meet these folks where they are and understand them and try to approach them. It's funny, I've had an epiphany. Early on, I did too much of this. And I was a little too preachy and teachy. And what I found is it seemed to be hardening the resistance. And when I went back to my own clinical experience on that, I'm like, I've seen this before. I need to approach this differently. So that's my best thinking on it at this point. I'm going to keep trying.
Jim, I used to consistently tell people, you might be right, but you're not effective. And I think that's what you're talking about. How do we know we're right on masking. Even the anti-maskers, I think they really know that it's the right thing to do. But what you just said, we've got to be effective. It's beyond being right.
So, Jim, let me change the subject on you, because you got to remember, I'm an old cynical ER doc, and I take care of people that don't listen to you all the time, right? I mean, whether you're not wearing a helmet riding a bike, or whether you're not wearing a helmet riding a motorcycle, or that's just what I did. It's always bothered me since the beginning, and you know this, I've been very vocal about it, that as much as we could preach masks, social distancing, we were going to have a segment of the population that wouldn't believe it, and we really had to be ready as a state. We only have 1.8 million people to try to do the other things, right? So the analogy I always used is, you can have all the protocols you want in the field for a heart attack to prevent a heart attack, but once you're having a heart attack, you better have your systems in place to take care of them. I think we've largely missed that window. I don't think we're doing contact tracing at all. I know we're not. Testing now is still available, but it's almost beside the point, because there's so much community spread. So now that we're not prepared, we're not prepared as a state for what we're going into. What advice do you give to families and people still? Is there anything on the treatment side that you would say, hey, this is what I want you to do today? December, we're in the first week of December. You still should do this if you live in the Treasure Valley or in Idaho.
Wow. That's a good question. I think, I think I'd fall back on, we still need you to understand that we are all aligned in wanting to avoid a blanket shutdown of the economy. That would be terrible. It would be terrible for public health. It would be terrible for mental health. I am completely aligned with the folks who say, don't take away our freedoms, don't shut down our economy. Agree. But we know exactly how to keep that from happening. And, I think the messaging just needs to be more explicit. The examples need to be more crystal clear. So I want to preserve anonymity here. I was interacting with a colleague not too long ago who suggested who had seen me in another forum and wanted to invite me to an event to celebrate. And so I guess this person is thinking if they wear a mask when they go to Albertsons, that's it. That's all you need to do. And I think we need to actually be quite a bit more explicit and say, listen, guys, if you're going to get together with people who literally don't live in your house, with very rare exceptions, you should all be wearing these things. And I know it's kind of a hassle for a while when you're in an indoor space. I mean, there's data out. The 6 foot rule is sort of it's kind of like a unicorn in terms of being magical, because I saw a study last week out of South Korea confirmed with genetic fingerprinting and camera evidence that one guy in a restaurant infected, I think it was 3 other people 25 feet away because it was indoors and people didn't have masks on and they were speaking loudly and laughing. This can be aerosolized. It can be spread that way. So I think explicit messaging about please, if you've got somebody outside your house and you're going to be inside, wear masks. No, Tommy, there's not a good treatment that's available. There's still not a silver bullet. And the last thing I'd want to try to do is start planting those seeds about the vaccine being a good thing. And try to start breaking down the resistance to the vaccine now. And on that point, I want to say maybe to the audience that might see this, we've been injecting RNA to arms for a long time. So the idea that we don't know whether or not injecting RNA is safe is actually kind of false. I mean, we've been trying, for example, to cure HIV for a long time. Yeah, we haven't been effective at it because HIV is not it's not SARS-CoV-2. But while we don't have a huge track record of safety with this vaccine yet, we have been injecting RNA vaccines for a long time into lots of people for lots of different potential efforts at cure or at vaccination. So that shouldn't get in people's way.
So I'm going to recap that because I love it. So it's still not just social distancing, but try, if you're not with your family or people you're around, you need to avoid contact, especially now while hospitals are where they are. And secondly, mask usage, it goes without saying. And then third, I love what you just said. The next big thing is we need to start breaking down barriers with that vaccine because there's going to be and is already a lot of counter messaging towards the vaccine. And in a state like ours, Bill and I have talked about this, we're going to rely on being able to get that vaccine out effectively, first to healthcare workers and the at-risk population, but then to everyone to try to, again, preserve freedoms, right? So that we're able to have the capacity that we have. So I love that, Jim. I thought that was great.
Thank you.
So, hey, Jim, talk a little bit about the vaccine. I watch a state like us, and you had a kind of a webinar type thing the other day, a virtual meeting on the vaccine that I sat in on, and it was really interesting to me how well organized I feel like we are. Maybe it's St. Luke's Health System, maybe it's St. Al's or whatever hospital systems. Is the state as organized with this as we'd like for them to be? Or are they kind of building it as they fly it right now too?
So the state is kind of the intermediary, right, between the federal government that's distributing it and then people like us who are providers and we're giving it. we knew very early on that we were going to be on the first bus, right, so to speak, that healthcare workers and vulnerable people, the most vulnerable, you're going to be on the first bus. So we've been down in the weeds of planning for this since the last week in August. So we've been at it for a while. I don't know. I know that the state has come forward with, a framework for who's first and then who's next. But I don't see the state of, I'm not, let me say it back to you this way. Outside of healthcare, I haven't seen yet that robust plan for executing on the delivery, because it's going to be complex. Remember, whatever vaccine comes, if I get the Pfizer vaccine in my arm, then I need to follow the Pfizer protocol. And I think it's 3 weeks later on the Pfizer vaccine, I need to get my booster, and it needs to be the same vaccine. If I get the Moderna, it's a different time frame. So ticking and tying and tracking all that and making it efficient, it's inherently complex. And in our health system, just as one example, I mean, for the super cold vaccine that we got to keep at minus 94, you thaw that, you don't want that to go to waste. So we're contemplating that we've got to have a call in immediately list for people who want to get the vaccine. Maybe they're not in the first tier, maybe they're in our healthcare provider second tier, but they're ready to be Johnny on the spot and get there for the vaccine. Well, if they were in the second tier and then they just took the place of a first tier person, just play this forward. Now, that first tier person maybe bounces to a second tier. They're going to get a different vaccine, and the person who jumped in line gets the first. Anyway, you get how complex it is.
Hey, Jim, I listen. If contract tracing, testing, that was one thing. I'm sitting here saying, I've been saying to all our guys, listen, if we don't scale this and modernize this and have technology help us, this is going to be hard because traditional health. One of the things that is exposed, I think, COVID is that just traditional healthcare for delivery of stuff that it doesn't normally do. It's just super cumbersome, and then you add HIPAA on top of it, right? So you got to have HIPAA compliant data that protects the patient, that also tracks these things. Listen, I stopped thinking about it a few months ago because I just shaking my head going, it's going to be. But I know you're on the inside, so hopefully you can because listen, one of the things that's frustrating, there's no shortage of money to fix this. It also has been a good lesson. The federal government threw millions of dollars to Idaho to try to fix all this. It just didn't go to work, right? And now you've got a vaccine coming that you're going to have millions of dollars to administer a free vaccine, but you still have to do the work, right? So I'm worried about it, but we'll see.
Our MadCap plan, I think the way we talk about it inside of healthcare is, since we're first on the bus, we can probably learn a lot, fail fast, hopefully, and then maybe be an example for, the other, whatever the next wave is, whether it's going to be our educators or large businesses or you name it.
Can you imagine right now actually doing vaccinations within a week from today?
Yes. I do think inside the healthcare system, we could be administering the first vaccines as soon as next Tuesday. I think the word from the feds will come this weekend. Then shipment maybe arriving Monday, and we'd be attempting to operationalize first vaccines as soon as Tuesday. That is another maybe point, though, to make here on this. Oh my goodness, Bill, you know, because you're all on our board, some of the mistakes we made early on, and we've sort of embraced this fail fast kind of thinking. Whatever happens next week with the vaccine, I promise you it'll be better the week after that, and the week after that, and the week after that. And we have to give ourselves give ourselves the permission to understand we're trying to do something incredibly complex. My little story about it just was hopefully to help people go, oh yeah, that is more complex than just getting a shot. We'll get better.
Hey, Jim, I think we've got you just for like 5 more minutes. And we've this has been fantastic. We will get the word out and thank you for being here. Can you close by just telling us a little bit? I think it's hard. I think healthcare workers in general just don't like to talk to the media. They don't like to talk about themselves. I mean, they just don't. I can tell you every time I get off the phone with one of my friends, my heart aches for them, right? I feel some guilt, like, man, I wish I was still with them in the ER, but they're feeling this right now. Hospitals are full, right? Can you just address that at the end, that we do need people to cooperate because we are there. And I've quoted you 100 times in the last few weeks that there is no cavalry coming. Idaho will have to take care of Idaho. And as the CMO of the largest health system here, what are your final words to people out there that'll listen to this?
Hi. It would be that we are, you described it as a cliff, Tommy, and that is the way it feels. I realize I'm now an exec in a jacket, but I still practice. And I said this the other day, the same people who are giving you this message are the same people who have been, taking care of your grandmas and grandpas and your moms and dads and catching your babies and setting your kids' arms and holding the hands of the people you love when they die. These are the same people. No, so we're not a cabal. We're the same neighbors and community members who have been taking care of you for all this time. And I'm speaking true when I say, Tommy, you are right. We're looking at a cliff. And I can't believe in my career that I actually think we're going to be pushed to the point of implementing crisis standards and making decisions to not allow access to certain types of care in the United States of America. I can't believe that day is upon us, and we're looking right over the cliff right now, and we can still take a step back. But it would require those specific types of actions by individual human beings who care about their neighbors and their friends and their fellow parishioners and their coworkers and all of it. And it might just be for a couple months to really double down and really own it. Own your own behavior for a couple of months and think about one another. Because I'm optimistic once we get to the spring. We're going to have more vaccines in more arms. It's going to get warmer. We're going to have the opportunity to go outside. But we're heading for this dark moment we got to avoid.
Right. Hey, Jim, listen, I just got goosebumps listening to you. Thank you for what you're doing. You're a dear friend. I respect the heck out of you clinically and through this process. Thank you for your leadership. And God bless you and all the people in that hospital that are literally grinding out shifts, loving, caring, comforting, consoling, and providing awesome care. Can't thank you enough. Thanks for being with us.
Thanks a lot, you guys. I really appreciate the opportunity.
Jim, thanks a lot. I am so incredibly proud of St. Luke's, and I really like the way we fail fast, and we're doing things that nobody's used to, and good on you. When you said that stepping back from the cliff, we still have time to step back. I just go, wow, that's exactly what we're talking about. Thanks, Jim, a lot. Everything you're doing.
Appreciate it.
Thanks, Jim.
You've been listening to the Inspire Excellence podcast. We hope you've heard something today that will inspire you to make a difference in the world. Join us again for our next episode.